Medical professionals say a public health crisis is underway in the Northwest. Oregon ranks as one of the highest states in the nation for opiate and narcotic addiction. Jennifer Dowling joins us now on how medical practitioners statewide are addressing it. Jennifer.
Chris, the problem is so big, the Oregon Medical Association devoted its entire annual meeting to the subject today. Doctors say one of the reasons for our high ranking, the overprescription of medications.
It has now reached the point where there are more deaths in the country from narcotic overdose than from motor vehicle crashes.
The incoming president of the Oregon Medical Association says the opioid epidemic impacts all economic and geographic areas, from urban to rural, rich to poor.
Oregon fluctuates between number 1 and number 5 in the country in the terms of the number of narcotic-related deaths in the state every year.
To tackle this huge public health problem, Robert Orfali says the 200 physicians and providers here today are taking a hard look at how they've been handing out medication.
Some of the information and the beliefs that we were using as a baseline for our prescribing practices have now been changed. New information has come forth that shows us that some of those beliefs are perhaps incorrect.
He says folks at this meeting will compare notes and develop guidelines to move forward. He says there have already been some changes, including recently passed legislation for a drug monitoring program to help providers keep tabs on what drugs patients are receiving. But more work is needed.
And that's why it is a complex issue and why we need to have a very concerted, holistic approach to solving the problem.
He says the real take-home message is that it's important for you to have a frank discussion with your doctor about your pain and all the medications you're taking so risks can be assessed. Back to you, Chris.